Hey girlfriend, this is Jan James. Welcome to the Hope After Breast Cancer podcast, where women who have endured breast cancer learn to have fulfillment over frustration, clarity over confusion, and faith over fear. We tackle the issues that many of our sisters face after a breast cancer diagnosis, from brain fog to fear of recurrence, from menopause to sex after breast cancer. This is the place to learn how to have hope after breast cancer. So strap yourself in. Welcome to the Hope After Breast Cancer podcast. Hi everyone, it's Jan James from Hope After Breast Cancer again, and I'm delighted to have our lymphatic therapist contributing expert Deborah Kellogg here today. Hi Deborah.
Hi, hello, thanks for having me again.
Oh, it is such a delight. I told you earlier that, oh my gosh, in our introductory interview, which is already on the podcast and on the blog, I just learned so much about the lymphatic system. I never had lymphedema, but you just taught me tons. And I just feel like our women need to be better educated about the whole lymph system, because it's true that women that have had even one node that's been removed could get lymphedema much later in life. Is that true?
That is true. That is true. Typically, it's going to be in the first 3 to 5 years, but you can have a late onset, and it will. It doesn't matter. It's just that the lymphatic system has its challenges, and just wherever that tipping point is for each individual.
Oh, that's so crazy. Stupid cancer has always got another twist and turn, it seems like, in the deal. Yeah. So can you tell the girls a little bit about yourself, and then just like an overview of the lymphatic system and the kinds of things that you deal with in your practice every day?
Absolutely. So I'm Deborah Kellogg, and I am a certified lymphatic therapist. I'm also LANA certified. And at Pink Ribbon Lymphatic Massage, what we've done is we've kind of dedicated our care to the maintenance phase of lymphedema treatment. So that's after your volume has been reduced, you're done with the bandaging, you're in your compression wear, maybe a night garment, you have your pump, you do your self MLD, and we're there to help support you, pamper you through that stage, and also to be another set of eyes to watch you in case something comes up where you may need to revisit clinic, because lymphedema can be progressive, but it can also be reversed, right? The symptoms, the swelling can be reversed in many cases. So we want to get you back in the clinic for complete decongestive therapy if any need should arise sooner than later. If that makes sense.
You know what? I'm gonna pop in here because, number one, I don't know what MLD is. What's that? MLD.
Oh, I'm so sorry. That's the manual lymphatic drainage that everybody should have been taught at some point. They've had lymph nodes removed or.
Right. You and I discussed this, that in our first interview. I was never talked about the lymphatic system at all. Zero. You were saying things in our first interview.
Yes.
Like I should have been measured.
And I'm sorry, we're breaking up a little bit, so okay. I hope I'm not speaking over you.
No,
I want to teach all of you the zero. Yeah. And you all need to know the self-care, right? Because you could have absolutely no symptoms, be A-okay, perfectly fine. Let's keep it that way. Let's empower you with knowledge, empower you with what to look for and how to prevent lymphedema. And if it's going to come on just simply because, that's how your body is responding, then let's empower you to find the correct care and to know what that entails and to think about it the right way. Not, it's very hard when you have something that is so demanding on your time to think about it in a positive way. But again, knowledge is power. As far as if it's there, let's at least know how to treat it and make the most of it and minimize its impact on quality of life.
Okay, so let's talk about two things. What does the
Okay.
lymph system, what does lymph and the lymph system do? And how would I know? I've never had lymphedema. I was fitted for a sleeve, and I guess that was just because in case I traveled, but I wore it once or twice, and I've never had any lymphedema symptoms. What would I look for to know if I had lymphedema?
Okay. So first off, your lymphatic system is it's like the garbage disposal system in your body. Everything we do, our body buzzes with chemical reactions. That's how we work. And I like to think of those like the exhaust on a car, right? Your car runs off of gasoline and it creates waste product. Well, the chemical reactions in our body, our cellular reactions in our body produce waste as well. And then also as cells are always, they get broken down and eliminated and new cells are produced, and all of that is waste. And then there's viral loads and bacteria and things that come at us in our body that we need to the lymphatic system is the important part of the immune system, because it also takes let me back up. All of this waste is just willy-nilly in between the cells. And the lymphatic system is similar in design to the cardiovascular system, in that it's a series of vessels that go from small to large in order to process these lymphatic fluids. So the job of the lymphatics is to get all of this debris, waste, broken down materials, fats, proteins, other things in the body, draw it into the lymphatic system where it can be controlled and brought back into your cardiovascular system, right about here where the pressure is lowest, so it can move from the lymphatic system back into the cardiovascular. And then your kidneys and your liver and can process, and you can end up eliminating that waste. It's also important for homeostasis, for fluid balance. It's got a big job to do, but essentially healing an immune response and protecting you.
Right. And you and I had a recent conversation because I bought a rebounder, and some of the other girls inside Thriver Nation bought a rebounder. So now we're all jumping up and down on our mini tramp. And I had asked you, is that something that you're a fan of? Because, does it have a pumping benefit for the lymphatic system?
Yes. And I'm going to be honest with you. I don't know the precise mechanics behind it, but I do know that it is recommended. It's very good for you. Mm-hmm. Anything movement oriented is good for the lymphatics. I have a theory in my mind, but it would just be me speculating. But I think it's really the rhythmic motion that would be most beneficial. And then as far as propelling it up through the valves, through the lymphatic system, I could see how that would be beneficial.
Right. I saw one other provider. I just watched a video this week, and she was saying that it's the action of your feet hitting the trampoline that causes the compression so that the lymph is pushed back through the system. It literally is creating like a pumping action. But yes, that was also talked about, that movement of any kind is the way that the lymphatic system works best. Now, my dilemma is I'm sitting behind the keyboard almost all day, which is why I got the rebounder, and I'm not a fan of exercise. And the rebounder is really easy to go do 5 or 10 minutes on a couple of times a day, at least, to get my system going. So I'll report back to you with the results. Anyway, so that's awesome. Hey, can I throw you a few questions we had from our membership gals in Thriver Nation? Would that be okay?
Please do.
Okay, Susan asked, do I have to wear compression sleeves while exercising, such as yoga or weights?
No, you do not have to, although it is extremely advantageous for you to do so. It's just that, like the pumping action with the rebounder that we were just discussing. So you have internally, you have the muscles constricting and creating a greater force into the interstitial spaces that help your lymphatic system to draw in any excess fluid. So let me back up. If I had a glass of water and I had some red dye and I put 2 drops of red dye in, you'd see the red dye all, sorry, words. I've been traveling.
No, that's okay. Like distributing through the water. Like, is that what you're talking about?
It dissipate, and then the water may turn pink or a light shade of red. It's because the physics of the gradient pressure. So you're going to, anything that's in a high pressure that's introduced to a lower pressure, it's going to spread out, right? And equalize that. So that's how your lymphatic system works. So we're working with pressures. Muscle pump under the skin creates a pressure. Now, if you also have an opposing pressure on the outside of the skin, which is what is so advantageous with compression, then you have a double whammy of goodness for your lymphatic system. So actually in the clinic, during the intensive phase, we'll often wrap patients and then have them do specific exercises that do just that. Move the muscle while the tissue is compressed. So yeah, I would definitely wear the compression during exercise.
That's a good explanation about why the compression garments are good for you. I wouldn't have thought about that. Why is it that they're recommended during during airplane flights?
Because it's that pressure. It is because of the, Bill, help me out here. The aerospace engineer, and my brain is just fried. It's the barometric. It's not barometric pressure. It's because the air is thinner.
There we go. Okay, we got it.
Air is thinner. It's less compressing, right? It's like that bag of chips when you drive up north. It starts out normal, and then you get there, and it's like this big old puff ball.
It's ready to explode, right?
External pressure. So the same thing is happening to our body tissues.
Interesting. Okay.
Yeah, impaired or a challenged lymphatic system, that lack of external pressure, the puffy bag of chips, puts us at a disadvantage.
Very good explanation. That's a good visual for me to think about. So yeah, we used to go up to the mountains in Arizona all the time, and every bag of something was always looking like it was going to explode any second. So yeah, that's awesome. Okay, Vicky asks, I had 10 lymph nodes removed, 7 with cancer. Does heat make lymphedema worse? And also, does lymphedema only affect your affected arm and chest?
Those are really, really good and important questions. Okay, heat. Yes. Heat is not very good. And again, we're going to always go back to that pressure gradient because that's the basis of how your body works. So when you are introduced to heat, your body wants to cool down. So your blood vessels will dilate, right? We want to get more oxygen, and we want to cool off. When your blood vessels dilate, it alters that pressure gradient, puts a higher demand on your lymphatic system. So yes, heat will always challenge you. I think if I understand the question correct, so one arm or one area affected, are you thinking would the other arm potentially be affected as well?
Right.
It could potentially, is swelling. And what we're finding now, I just learned this a couple of weeks ago, is that in a small portion of upper extremity lymphedema patients, you do start to see it on the other side. And I don't know why that is. We're still learning,
Right.
but I don't want to say that and be alarming. Okay. I want to say that, and so that people are aware that, yeah, it does happen to a lesser extent in the other limb from time to time.
Right. Okay. This seems to be a good time to maybe ask about what are we looking for in our bodies to happen, symptoms that would cause us to go see a lymphatic therapist to just double check and make sure lymphedema is not creeping into our lives.
I love this question because this gives you the power. Because I think a lot of women, and then certainly people who've been on a long health journey, start to think, is this all in my head? Or I'm just imagining this, or I'm just paranoid. And I want that. I want you to respect that voice and listen to it, because you know your body better than anybody. And it's your body, and your body is going to be different than anybody else's in the room. So I looked this up, and I wanted to be very specific. There is a latency stage of lymphedema. So you can't see anything. Your tissue feels the same, but you might have a feeling sorry, I want to make sure I get it all. A feeling of heaviness, achiness, maybe some subtle changes in how your clothing fits. It's not consistent, right? You may feel it here and there, and then you're fine, and then you feel it again maybe a little bit later. Though, go in, find, hopefully you already have a lymphedema therapist, go in and get seen. Because if it's the latency stage, it just means that, okay, we've got a little insult to the lymphatic system, and we're starting to feel some effects. Not enough to change tissue, but you're feeling it. And then the challenge is over, and you go back to feeling just fine. And that's fine, but that we need to maybe start wearing some compression a little bit more. And what they found is if you go in and you get that addressed early on, that the complete decongestive therapy stage can be modified and really streamlined. So it's extremely advantageous.
Okay, but what happens if I ignore how I'm feeling? What am I going to be experiencing?
So if you go in from stage 0 or the latency stage into stage 1, then you'll start to see some swelling.
Okay.
Some really mild swelling, but it resolves.
Does it feel tingly? Does it feel painful? How does it feel?
Yes, it can feel all of those things. Heavy is what I hear most often. And again, how the clothing fits is a real indicator that something's going on. But stage 1, it reverses.
Okay, that's awesome. Now, does that, it's different than the way, it's a feeling that would be different than if you just put on a couple of pounds, right? And definitely, is it always your arms? Does it always present in your arms?
No, it can be in your trunk too. It depends on you and how your anatomy is and what lymph nodes have been affected.
Gotcha. Okay.
Your breast. Yeah.
Interesting. Okay. Sarah is asking, are there any nutrition components that can reduce the risk of severe lymphedema? And does overall health, like weight and exercise, make a difference?
Yes. So that's a really good question. And I had to reach out to a fellow therapist, Andrea Brennan. And she actually gave me some articles that, Jan, I'd like to give to you that maybe you could put on your site, on your page.
Right. And I'll put them in the description of the podcast too.
Yeah, that would be great. So one of the articles really goes into a lot of detail as to a lot of different diets. So that's really good information. But really, the bulk of it is you want a low inflammatory diet. Inflammation creates a demand on the lymphatic system. So whether that's intermittent fasting, or keto diet, or whatever. There's all those diets out there, but definitely anti-inflammatory in nature is beneficial.
Awesome.
And then as far as exercise, yes. You always want to increase your exercise slowly. I always encourage people to do a good warm up and a cool down, because what are we doing? We're vasodilating when we start to exercise. We're getting blood to the extremities, so we want to give the lymphatic system time to catch up, and then we want to cool down, so we give the lymphatic system again another opportunity to use that muscle pump at a lower rate, just to kind of equalize. So it's just gentler on the lymphatic system, and it's all around good practice.
Wow.
As far as weight, that's a big factor. So our lymphatic system, the superficial lymphatic system, that's used most to reroute, right? Which is brilliant, because we wouldn't want to reroute in our viscera or in our internal organs. So let's put it out here where we can take it over, we can take it down, we can do whatever. That's kind of in the fatty layers. So if you have more adipose or fatty tissue, it would be like taking a curvy road, a more, what do they call it in the textbooks? Doesn't matter.
Like a road like that's got those switchbacks, that kind of thing, like that.
Yeah. It's harder to get from point A to point B.
Right. Makes sense.
Yeah. So the lower, your body fat, the better. I need to retract that. That's weighted incorrectly. A healthy body weight will help your lymphatic system.
There we go.
By not increasing the challenge.
Very good. Okay, that's awesome. Well, good. Well, thank you so much for being here and for giving us more education about the lymphatic system. Yay. I really, every time I'm with you, I just am learning so much and everything. Is there anything else you want to share with us?
Yes, there is. I want everybody, because I don't know what the level of education that everybody has received. And really the most important thing that I want everyone to know is how to recognize signs of cellulitis.
Oh, right.
Yeah. So it can happen very rapidly, and it can present with local sensitivity or pain. It can be on your arm, your chest, your back, wherever. You may have a fever, may or may not, most likely have a fever, and it's a rash-like appearance, and it can be hot and red. If that happens, I want you to contact your doctor right away. If you can't get a hold of your doctor, I want you to go to the emergency room, because that is potentially life-threatening. So it doesn't happen all the time, but I want everybody to be aware of it, and I want them to know what to do if that presents. And a trick that oftentimes your doctor, your nurse, or in the hospital that they will do is, if you start to have a rash, they'll take like a little marker and they'll just draw around the border. And then real quickly if it's starting to move beyond that border, and that's an indication of spread. And certainly if you ever see red streaks, then I just want you to go right to the emergency room. Right. Because if it's they can they'll probably do an ultrasound, make sure it's not a blood clot, give you antibiotics, and it can be a non-issue.
So it's an infection really is it of the lymph or of the, what is it?
It's the cells.
It's the cells. Wow.
Yeah.
Well,
And you don't,
cellulitis, right? Yeah. Inflammation. That would be inflammation of the cells if I think about it, right?
don't want it to hit your bloodstream.
Gotcha.
So that's why you want to act fast and get the antibiotics and just, get it taken care of.
I have over the years known many girls that have gotten cellulitis, and until I talked to you the last time, I did not understand that that was even connected with the lymph system. So it's something that I think we all just need to be aware of. So I appreciate just having that knowledge and the heads up on that. And you're right that it may present, like if it's on your leg or something of that nature, that it could be a sign of a blood clot or anything painful, that kind of thing. Is the skin, when cellulitis presents, is it the skin is sore, or is it under the skin, the muscle tissue, or do you know?
I don't. I think it's just the skin.
Okay.
I could be wrong though.
Yeah, okay, trick question. So sorry about that. No, that's okay. That's okay. I'm just curious. But yeah, I think if anything like that presents, guys, we need to take action and not wait for it to go away. But I like being reminded of the idea about drawing around the rash, because that is a really, it's a super good way of understanding if it's increasing or decreasing. So very good. Okay. Thank you for sharing that. So that's great. Okay. Well, we're going to sign off for now. This is Jan James from Hope After Breast Cancer with our lymphatic therapist expert, Deborah Kellogg. We're signing off for now, and we'll see you next time on the Hope After Breast Cancer podcast. Thank you. Bye-bye. Girlfriend, thank you so much for listening to our podcast. I hope you found some nuggets to encourage you and give you hope. Make sure you subscribe to the podcast. You never want to miss an episode. And we'd love to know how we're doing, so please be sure to leave us a review. Until next time, this is Jan James encouraging you to remember there is hope after breast cancer. See you next time.